doctor for dental implants can be so profound. For over 20 years, we've set the standard for expert dental implant surgery and prosthodontics, restoring confidence and beautiful smiles. Each week, we delve into why expertise matters, providing essential insights to answering your questions. Join us to learn how to avoid the common pitfalls and ensure the best outcome for your dental health. Let's begin.
Good morning, everyone, and welcome to today's live stream here at Trust Implants in beautiful Newport Beach, like Dr. Willardsen would always say. We're here.
It's a beautiful place.
It is, especially now around this time of the year.
Oh, it's amazing.
It's beautiful weather. Every time I talk to someone, anywhere they are, I'm like, man, it's hot here. And then they check the weather. It's like
66.
66, 75, nice and sunny. And they're like, you should not be complaining at all. But yeah, it's nice. But Dr. Willardsen, how's your week?
It was good. Weekend. It was very good. Yeah, weekend. Speaking of that, we had to go out to Temecula, which is about 30, 40 minutes away, and get out there and you feel like you're in the, close to the sun. It's so hot, but it's in reality, I grew up out in the Inland Empire, so I am very familiar with the heat and you become accustomed to it. But we get spoiled here, no doubt about it. So,
yeah.
But really. Yeah, I had a great week. My granddaughter was in town, and so that was really fun. We'll kind of go through some photos here. So it's kind of the first time. She just turned 1, and it was the first time we got to really spend quality time with her, and she kind of likes me a little bit. So the stranger danger is going away. So that's pretty amazing. So it was just so fun. This is my son, Zach, and this is Winnie. She's, like I said, she just turned 1, and it's just a wonderful thing, as the family grows and as we progress along, every stage of life is so good,
Yeah, that's awesome.
And then my wife and I and my daughter Elsa, we went to the Luke Combs concert, which was really good at SoFi Stadium. Have you been to that stadium?
Yeah, we actually went.
It's amazing.
It's huge, and it's as soon as you walk in, it's like, yeah, it's amazing.
Oh, it's wild, and it was packed. Like even the very top floor, rows, seats were completely packed. It was a very good time. So.
Well, we went to the football game. Remember?
Oh, that's right. We went to the
probably
Raiders
a couple years ago, a year ago.
Or the Chargers and the Rams. Yeah.
Yeah, and you guys had way better seats than us. But
we bought them last minute. It was completely last minute. So, and I don't know how we got such good seats, but they weren't that expensive.
That's what he had said. But here's the thing: is even ours, they weren't even sucky. They were expensive still, but we were in the very top. That was still an experience because you got to see the whole thing.
Yeah, it's amazing.
So
even the worst seats are not bad.
Yeah. But they're costly.
Yeah.
But anyway.
And then I think I said this last week, but my daughter's got her permit, so we're practicing driving, which has been really interesting and fun. And luckily she's got plenty of experience because when we're in Montana, which we'll be there next week, she gets to drive on the dirt roads, and it's kind of like she has free reign to the mountains, and this, it's a pretty good place to learn how to drive. I knew growing up, we were in Utah a lot, so in this tiny little town, Manti, Utah, so we could easily drive around town, drive in the hills, go four-wheeling, even when I was, 14, 15 years old. So
yeah,
so it's been good, but. And then the other thing I did this week, which I've never done, and you probably have done, Andrew Huberman talks about, and everybody, Joe Rogan, everybody talks about the, ice baths and cold plunges and stuff. I did that this week, and oh my gosh, that's pretty impressive. Have you done it?
I have. Not as much cold plunges. I do cold showers. I don't want to say every day.
There's ice cubes in the water. It's cold. It's like, in Russia, we got Dennis, our producer here from Russia. He says that in Russia, when it's negative 60 below, they'll break the ice and jump in the water because it's, 32 degrees. It's not frozen yet. So that's like a hot tub,
Yeah. That's crazy. But that is, I watch Huberman and we talk about this all the time, but that is what we call, even though it's such a quick I don't want to call it fixed, but kind of, it's expensive dopamine. That's what we call it. Because you can get cheap dopamine from like eating candy or
carbs,
sugars, whatever it's cheap, right, to your brain. But stuff like this, like going on a run, doing a cold plunge where like it's something hard, but as soon as you do it, like your dopamine levels you're way motivated. The rest of your day goes smoother, right?
Yeah, in fact, so the lady, they have these places. You got the cold plunge and then you have a sauna. And she's like, yeah, you can get in the cold water, maybe 3 minutes. No, I mean, 10 seconds. Initially, I was like, there's no way. 10 seconds I was out. And then I went back in. I got to about 30 seconds. And the most I could do was like 45 seconds. Oh, wow. No way could I stay longer because it's a major shock to the system. But as you get, as you stay in longer, you become more accustomed to it. Yeah. So I'm definitely, it's amazing.
Yeah.
I'm definitely like that a lot. So.
Sure. Well, I know. Well, there's a few things that I want to go over, Doctor. Which, by the way, I wanted to go back to talking about Whitney because with my knees, they're kind of the same issues. I think she's like 9 months older,
right?
But they're just you always see like your like babies here and there from like people that and it's like they're cute, they're something, but when they're in your family. She's just my niece, but she's my sister's, and I can see that like features of our families, right?
Isn't
like
that
parents,
wild?
And you're like, what? There's like a different love you have for them. I don't know, it's different.
It's so true. I mean, I look at Winnie, and I see so much of Zach, my son, and also Hallie, his wife, and it's just amazing. And by the time they left, they never get breaks. Like they're always working. So finally they got a break and they came to California because they live in Utah. And this was I think it was the first time Winnie had stayed, wasn't with Hallie and Zach. So stayed with us. And by the time that initially she had kind of the stranger danger, but by the time they came to pick her up and were leaving to go home, she wanted my wife constantly. So it was really fun to make those connections. Those are lifelong connections. And of course, I'm reflecting back on my youth and my grandma, grandparents, and that sort of thing. And, the love that you have. And I just love to see that come full circle,
Yeah,
it's like, they say like the eternal round, it just comes full circle. And, in reality, that's what life is all about, right? And so it was really nice. It was fun.
That's awesome. Yeah, that's great. Okay, well, going back to what I wanted to talk about, there was a few questions from last week's live stream that we didn't go over that I do want to go over because they were actually pretty good questions from one of our viewers named Cassie McDonald. So the first question, and we were talking about like placing the prosthesis, right, and how these doctors down in Southern California,
in Mexico.
Not San Diego, will take you to Mexico and do the whole procedure. Her first question was, what determines if an implant can be loaded immediately or not? Is it the brand and type of implant, or is it the technique that the dentist uses?
That's a very good question. So I'm going to probably have to go back to some older live stream photos. Hopefully I could pull it up quickly. So if we look at, these are implants that I had removed. And if you'll notice, there's really no thread on this implant. It's very, one, I've kind of removed them because I had to use a drill that, anyways, they're not very aggressive, the threads. The titanium is an alloy. And I don't want to just keep rehashing the same thing over and over. Hopefully I can pull up some images from with some, real implants that have an aggressive thread on them. Shoot, I didn't know we were going to. But anyways, here we go right here. So if you'll notice, here's an implant that has a very aggressive thread. And we've talked about this. It's kind of like a wood screw. The preparation of the hole or where this implant goes into is very technique sensitive. So what determines whether or not an implant can be loaded immediately? Obviously, she's been educated. She's, even to have the term immediate loading in her vocabulary is good. But it's all about the technique of placing the implant. So obviously the design and the brand of implant matters, because there's just not a lot of these implants that have this sort of an aggressive thread. So you have the design, you have the surface texture, which is the texture of the titanium around the implant. Each system, each company has a different surface texture. The surface texture, what that means is they roughen the surface of the implant. And what happens is if you were to sandpaper say you're to sand your car, and then you pour water on it, the water is going to attract to that sanded area, right? Versus a polished area, it's going to kind of disperse, okay? So the surface texture of the implant is really important because the blood draws into it, okay, versus is repelled away from it. The original implants that were made were actually, we didn't realize this when back in the initial days of implant design and development. These implants are almost polished. It's almost a polished titanium. So again, we kind of give that analogy of the sandpaper on a painted surface. And if you were to wet that, the water will draw into it, versus a polished surface, the water is going to push away. Blood is critically important for the longevity, success of the implant survival. So as that blood is drawn in, the BMPs, all of the stem cells come in and they start to heal the bone around the implant. So it's a very good question. I could talk about it for hours, but we won't do that here on this live stream. But it is critically important. In fact, most of the corporate all-on-4 centers, or even the new implant centers that are popping up all over in each city, they end up using an implant. Usually it's a Neodent implant. And so if a person is going after these sort of procedures, ask two things. One, am I getting 6 implants or more? Okay. And two, what brand of implant am I getting? And if it's, usually they're getting the Neodent, which is a less expensive implant, owned by one of the larger implant companies, but they do this on purpose. It's interesting how in every industry, whether it's the airline industry, whether it's the media, all the media sources are kind of owned by the same person, right? Or automobile industry, Volkswagen, they own Volkswagen, Lamborghini, Porsche, they're the conglomerate, right? Mm-hmm. And so it's the same thing in the implant world. You have these larger implant companies, they buy up these smaller companies, keep the name the same, but in reality it's kind of all one.
So they can say it's a smaller company.
Yeah. So Neodent, 99% of the all-on-4 centers use Neodent. Why? Because it's $100. It's a $100 implant.
Yeah. Well, I want to get to that, but let me just go over the other question, because that's something I do want to cover in today's live stream, is the all-on-6 procedure. We've talked about this, but we'll get to that in a second. Which, by the way, from the answer that you gave me, makes me think there's so many little details that come into place. Like
so many details.
Like you said, just the blood.
I could spend hours just on the implant itself. Surface texture, internal connection, how the parts and pieces fit together. What is the connection? What design of connection is it? Back in the day, which a lot of the clones today have what's called the TSV, or the tapered screw vent connection, which is an old patented connection from the 90s. Still today, there's like 6 or 7 brands that are still using that old connection. But they just change the name and they'll change a certain feature on the external aspect of the implant. But the technology of the connection, how parts are connected to it, is the same as it was back in 1991, Oh,
well. Yeah,
not the implants we use, because our connection is very advanced. And so that's why I'm specifically choose Noble Biocare implants, because it checks all of the boxes.
Yeah. Well, and again, you only do dental implants. It's not like you'll do implants here and there. So you've been doing it for so long. You've seen the industry evolve and what has worked, what hasn't worked, especially in like your cases. I remember you've used there's been a couple of times where you've tried other really big companies and they haven't worked. But we'll get to that. Let me just cover the second question, Doctor, from Cassie. That was a great answer. Second question is, why would a periodontist be doing all on 6 on top and bottom and give a patient dentures and then turn the dentures into temporaries?
That's, as the industry progresses and as we become more versed in like the digital side, which is a completely separate topic, but so it sounds like she's having the procedure done. Fortunately, she's chosen a specialist, a periodontist. And then also, so the periodontist most likely, usually, hopefully, is going to use the best quality, whatever it is, implant, graft, technique. So they're taking her denture and then they'll transition that denture onto the implants that are placed. It's pretty common practice. And it's, there's nothing wrong with that process. He's trying to give her a fixed prosthesis as soon as possible. Sounds like he's probably not loading it immediately. Maybe he is. I mean, she asked the question about immediate loading, which I kind of didn't get into. With immediate loading, you have to have a certain number of or value of torque. So as we looked at those aggressive threads on the Noble Tie Ultra or active implant, if I have, because I have a torque wrench that tells me how much torque that implant has. In some cases, I'll put in 6 implants. Everything has 50, 60, 70 Newton centimeters of torque, but one of them might only have 30 Newtons. So I can't load that implant. It has to sit. Again, we've talked about in other live streams, we cannot break these rules. Like the body has to go through its process. I think it was last week or 2 weeks ago about, if you break your arm or when your shoulder was, you could tell that it was not feeling great. So you're in the ring. You can go to a chiropractor or go sit in an HBO, like a hyperbaric oxygen chamber, or get a steroid injection, or, go do some magic, technique that somebody's using. But the reality is that tissue has to heal. It has to go through its process. There is no magic. And so on an implant that has a lower torque value, I cannot load that too soon, or otherwise it will fail.
So even if, let's say, 5 of them are good and the other one is not, you won't load.
Yeah. So you could load the 5 that are good, but you'd have to leave the one out of the equation. And sometimes we'll do that. It just depends on the case. It is very dependent on, the patient and the case and the situation. But if the torque values are low, and that's usually because of bone density issues or sometimes over preparation of the hole or the osteotomy. So if the doctor's taken the, prepared the hole to the drill, the specified drill that the manufacturer is requesting, if they go all the way to that final drill, but the bone is relatively soft, it's going to be a very low torque value. So we have to under-prepare the hole, make it smaller, and then drive the implant into a smaller hole so that's how I get my higher torque values.
Yeah. I think you've mentioned that. Yeah, you prepare it so it's actually, it's tight. That makes sense. Well, that's great. Thanks for answering those questions. Now,
those are good questions from a patient that's, fortunately she's doing her research.
Right.
Sounds like she's in good hands.
Yeah, sounds like, the live stream's kind of working. Right? We're answering questions for people. Like she could be, I don't know, in Florida, right? And she has these questions, and where do people go to get these questions answered? I don't think there's anywhere. But the main topic of today's live stream that I wanted to talk to you about was the all on X procedure, because I've seen tons of ads online, right, on TV, social media, YouTube, everywhere, of implant centers and even just like other doctors offering the all-on-X procedure. And I thought we were one of the only practices, and pretty much the whole country, because we've had people come from other states, that we offer the all-on-X procedure. But I think there's a catch to that.
There is.
And we kind of talked a little bit about this, but I want to hear your thoughts.
All right, yeah. So the all-on-X, and I wouldn't ever want to take credit, but I feel like what we're doing here has kind of shined a light on the all-on-4. And so now what you're seeing is more all on X, right? Because
So, doctor, sorry to interrupt.
Yeah.
For the people who don't know what all on X mean, can we explain all on 4, all on 6, and then all on X?
Absolutely, yeah. So let's look at the all on 4. So here's an all on 4 case. You can see there's 4 implants, right? And that is, a year ago, 2 years ago, 3 years ago, everybody's pushing all on 4, all on 4, all on 4.
So I don't know if I can show, but all on 4 is basically, to like explain, is one arch has 4
supported
implants.
by 4 posts,
implants,
4
which
implants.
means the entire prosthesis, or you would get 4 implants on like your upper arch, and then 4 implants on your lower arch.
Right.
All on 6 is 6, obviously, and then all on X is when you can either do 4, 6, and some of our cases, which we'll get into, 6, 8, maybe even 10.
Mm-hmm.
So I think
here's an all on 4 case, and you can see there's 4 implants, and a few years back that was what everybody was promoting, but as we've shined a light on the all on 4, and you can see here, these are just different images, but it's just not, you have no support in the back of the jaw. Everything's concentrated in the front of the jaw. So
yeah, and like we've talked here, doctor, and I think it's good repeating this because we do so many live streams and we have so much content that a new viewer is not gonna have seen everything else. But as everyone knows, we chew with their molars. Like when you eat steak, when you eat anything hard, you're chewing with the back of your teeth.
Yep.
So if they put all the load in the front,
it defeats the purpose, right?
Exactly.
Yeah. And we see the complications with that over time. So we're talking about all on X. So now they've kind of transitioned from, okay, so we've shined a light on all on 4. We've talked about, what are the kind of the drawbacks of the all on 4. So let's change the name and call it all on X. But that's, to me, I would rather the doctor just be straightforward and just say, look, we're doing all on 4, Whereas all on X is kind of like, you remember, you're probably too young for this, but I remember when I was a kid and Saturday mornings we'd watch cartoons and eat cereal, and you'd open up the cereal box and there'd be a mystery prize in the box, right?
Oh, yeah, I do remember
and
that.
So you get the mystery prize, you don't know what it is till you open the box. I feel the exact same way about the all on 4. Patient doesn't know what they're getting until they wake up, and doctor will be like, oh, Mrs. Jones, guess what? I'm so sorry, you didn't have enough bone, but you got 4 implants today. And so, and that's because, Dr. Smith wasn't versed in managing or the sinus or putting implants in the posterior or the back of the jaw, so they end up getting an all on 4. And so my point is that all on X, it leaves it open. It's like, you may get 4, you may get 6. Most likely, you're going to get 4.
You're going to get 4.
Especially these newer implant centers, they are, they've learned one technique, and it is the all on 4. And I kind of think of it, and I feel bad for these doctors because I see some of these posts from some of these corporate centers that, they're welcoming this new doctor so-and-so to their implant center. And then this doctor walks into a case or into a surgery, and it would be almost like me jumping in an F-16 jet, right? I mean, in dental school, I flew airplanes and, Cessna 150s, tiny little airplane, right? Very simple, very basic. The instrument panel is very basic. I know where the throttle is. I know where everything's at. Versus sticking me in an F-16, I wouldn't even know how to start the thing. I wouldn't know how to do anything. And I feel that's what's happening. These doctors are getting thrown into situations. They got to figure it out as they're in surgery. And if they don't have the training or the background, that's all they're doing is trying to figure it out while they're in surgery. They're making these clinical decisions while they're in the middle of a case and the patient's either sedated or under general anesthesia. And so in reality, I kind of feel bad for these doctors because they're just kind of flying by the seat of their pants. They do not know what they're doing. They don't have the training or the background, and in the end, it's the patient that suffers.
Yeah, and what this makes me think is they're promoting this like, we'll give you all on X, right? It could be 6, it could be 4.
It's the mystery toy in the
yeah, and they don't tell the patient. They don't show them the plan. Kind of like, I feel like something that we do here is you kind of have to really look at the X-ray, the CT scan to know how much bone there is. You really plan it. You even on the CAT scan machine, you know where to place the implants before you even, you're showing the patient. And there's a quote that I learned when I was on my mission that says, if you fail to plan, you plan to fail.
Yeah, it's
so
true.
If you're not planning, especially a case so big and so expensive, right?
Mm-hmm.
You need to really plan it out. Know the blueprints, the type of material you're going to use. We even know how long the surgery is going to be, right? We have everything prepared beforehand. And if these other doctors aren't really planning like that, again, if you fail to plan, you plan to fail. And that's why we've shown so many news commercials and articles of just saying this dental implants are failing and failing, and this is why.
Yeah,
they're not planning.
In fact, that same news reel from Arizona, they did a second piece. I don't have it on here, and the second piece was because initially they talked about the number of failures, right? That the industry is not really telling patients how many failures there are or complications. But of course, as more implant centers come to the marketplace, and you have these young doctors or doctors that haven't been trained, and you throw them into these surgical situations, and they have to figure it out on the fly, the number of complications and failures, of course, is going to go up, right? But the second piece of this news, clickbait news thing was that the reason for the failure rate going up is lack of training for the doctors. I'm like, that's actually a good piece of, good. It's not fake news. So, and it truly is the case. There's just not enough. There's not enough programs in the country to even come close to being able to train doctors on the complexities of the procedure itself. And again, I kind of use the F-16 or F-18 analogy, but you have to know how to manage these cases. It's very important.
Yeah, you know what? I was just thinking as you were saying that is, you have tons of videos. We should put up educational courses for these doctors that want to do that. 'Cause, we do have them because there's just so much to it. Like the more we do these live streams and the more that we talk about this I'm learning way more. Like you said, you can just talk about the implant for hours. I did want to show our viewers in what scenarios someone is going to need, 6 implants, 8 implants, 10 implants, and when the all-on-4 is a good option for them.
Yeah. So here's a patient who, and I've just kind of pulled these images off, but here was a case that came to me as an all-on-4 from one of these corporate centers, and I transitioned her prosthesis into an all-on-6. You can see that she has her 4. I don't know if sometimes these x-rays are a little, I can see them well, but a little difficult to read. But there's 1, 2, 3, 4 implants. That's how she presented to me. And so I went ahead and I grafted. You see this ball of bone right here? Mm-hmm. So I grafted her sinus in order to give her more support in the back of the jaw. So now when she chews, she's got an implant that's supported back here. Because when she presented to me, the prosthesis had broken. Actually, no, it was gone completely. The prosthesis broke out of her mouth because, they had extended, cantilever off the back side, and so it had broken, and the whole thing snapped out. So,
Doctor, quick question for you. Is there a reason why the implants that she came in with are way crooked? And the ones that you place are straight?
That is the all-on-4 technique, is to angle these implants at an extreme angle. So they put in a longer implant, probably a 13 millimeter implant, but they put it in at a super extreme angle. And the reason is you see this dark area right here? Mm-hmm. So this is the posterior maxillary sinus. And so they squeak these implants into this bone to avoid what they call intrusion or invasion into the sinus, because they want to try to avoid the sinus, and we've talked about this kind of a lot. But this is a good example of where you need to know how to manage and work in the sinus and put implants back in the sinus where they need to go, because this is an anatomical reality. Like everybody has this situation where in the back of the upper jaw, the posterior maxillary sinus is very close to where the teeth are. A lot of times, like the roots of the teeth are going into the sinus. So if you don't know how to manage or navigate around the sinus, you're not going to get implants in the back of the upper jaw. You just can't do it. And that's why Polamalu developed the all-on-4, angled the implants to avoid the sinus. And they, like I said, they kind of sneak them into this spot as close to the sinus as possible and use as long an implant as possible, as angled as it possibly can be. And then that's how the all-on-4 came about. And so the goal was to make the procedure less expensive, less invasive. Going into the sinus is not invasive at all. You just have to know how to do it.
Yeah. Man, yeah, this makes me think, because, sometimes the doctors can mess up. And since the patient doesn't know, when the patient wakes up, they'll just blame it on something that's going on there. Oh, it's because you didn't have enough this and that, so it didn't work out. But how would the patient know? Like, bro, we know the doctor messed up, but I don't want to get into it.
Actually, in this case, the doctor didn't really mess up. That is what the all-on-4 procedure is. And it's more a deficiency in the procedure itself. And that's why it's important to be able to know how to navigate and correct it. And that's why we end up getting a lot of patients from all over the country that once they realize what is necessary, then they end up getting what they want or need.
Yeah. So for the most part, all-on-6 is always going to be better than all-on-4 because you have the extra support in
the back of the jaw.
Jaw.
Where the chewing forces are.
Yeah, exactly, which everyone knows. Every time I talk to a patient and I explain this to them, doctor, it's like there's not been one person that said, oh, that doesn't make sense. Like everyone knows that. But I do want to talk to you about the scenarios where someone needs more than 6 implants and why that is.
Yeah, another great question. So when I have, for example, here's a case where patients, these are all periodontally involved teeth, so all of these teeth have to come out. And so,
can you explain that, like periodontal disease and why they have to come out?
Over time, what happens is if we don't, and I think he tried, he brushed his teeth and stuff, but just over time, not going to the dentist or having your cleanings done, if you don't remove the tartar and the plaque and the calculus, and I've shown some of the photos of that as well, that scenario, ultimately the bone starts to recede or pull away from the tooth, and then the teeth end up becoming loose, and so we have to take all the teeth out.
Okay.
And that was the case in this situation here. So we removed all of his teeth. And you'll notice we've got, 1, 2, 3, 4. We got 10 implants in this case.
Whoa.
And why is that? Because he has an extremely strong bite. But also, my goal with him was to try to replicate as much as I possibly can what he's lost. Now the teeth have to come out. So I want to try to mimic what he's lost. And so giving him more implants with a different type of design is going to feel more natural and give him, that final result that is going to feel like his own natural teeth. And so here's the final. I'll show you the bridge itself or the prosthesis. So this is kind of the underside of it.
Oh, whoa.
And you can see, It's just a very clean, aesthetic, hygienic.
And that's zirconia as well.
That's all zirconia.
Which lasts way longer than any other type of prosthesis.
So again, every patient, I will manage their case according to what I feel is best for them.
Yeah, and that's what when a place offers the all-on X, that's what they're trying to say, right? Or trying to say, or that's what the all-on X procedure is trying to say. It's like
with an out, with the loophole
for them is with an out, right? Because if they present only 4, they're not really doing all-on X. But everyone's mouth are different. Like yours is different than mine. Dennis is different than his wife. Everyone else. And so it's not a one-size-fits-all, which is what we're trying to avoid here, which is what the all-on-4 procedure is. And it's way cheaper, way easier for the doctor to do. That's why they're offering it. But when a place is offering all-on X, it means that whatever procedure they offer you is going to be tailored to your mouth. Now, if they don't know how to do that, then they're just clickbaiting, promoting just to get people in, right?
Yeah, so like I said, most of the time when you see all-on X, you're going to get an all-on 4. Just simply because of the fact that unless the patient has a ton of bone in the back of the jaw and they can, but usually that's not the case, and you have to kind of know how to navigate that. So, and like I said, a lot of times I feel bad for the doctors because they're thrown into these situations. They work for these companies, and so they're just stuck to do whatever the company tells them to do or what the limitations they have in their own background and training.
Right. Well, even when a doctor owns the practice and they sell to those companies, because it's a thing that's been going on around, it's these big companies are buying these private practices. They're buying 90% of their practice. Even though the doctor already has a reputation, they have their clients, the bigger company is going to come in and say, you're going to use this now, you're going to do this, you're going to do that. And so, I don't know. At the end of the day, I'd say people should do the research and try to avoid the all-in-4 centers that are like owned by big corporates. Because this is another thing, and I know we keep bashing on the all-on-4, but it's just what we keep seeing. This last week, I did a bunch of research because I wanted to know if there was anything out there that would tell us how long the all-on-4 procedure lasts. Everything I found said that it's an average of 10 years, at most 15 years.
For the all-on-4.
And this is, anyone can go online, look it up. There's plenty of articles, plenty of forums. I'm just thinking if you already know that 15 years at most from now, you're going to have to get it replaced and fixed for what you're already paying, how is that even worth it? Might as well really do the procedures that's going to last longer, like all-on-6, all-on-X. Here we've seen it, I don't know, I think 20 years strong, 25 years strong. Right?
Yeah, I've been doing this for a long time, so 20, 25 years. But, at the end of the day, it's just a matter of when the patients are choosing to have this procedure done, and especially now with all the marketing, there's so much noise out there with marketing, with all-on-X and all-on-4, that, it's very confusing for the consumer. And so it's important to do your research and ultimately they're going to choose, and wherever they choose to go, that's based, if they base it off of the cost, that's what they're going to get,
Right.
If they base it off of quality, training plus materials, and really it's training. If the doctor's trained, he's going to use the best materials possible and the best technique possible.
Right. No, yeah, and you're right when it comes to that. And I don't blame the patient usually because I've been in their shoes where cost does play a big part, right? I'll go to the mechanic he's like, you can replace the whole thing and it'll be good for, a long time, or you can replace this little part. And I'm like, well, how long is that going to last? He was like 6 months, but it's like a fraction of the price. I'm like, yeah, let's do it. Right. I'll be back here in 6 months, but a car is something different than your mouth.
Yeah.
Completely different. So you can't compare it. It's a surgical procedure, so it needs to be done right. It's your greatest investment, right? Your body, your health, all that. So
absolutely, yeah. It's critically important. So,
Well, that's awesome, doctor. As far as the all-on-X procedure, is there anything else that you'd like to tell our viewers?
On the all-on-X, not necessarily, other than just, if we look at, this was a surgery last week, no, this week actually. And so oftentimes, when the patient goes under and they have the implants placed, if, the surgical technique for placement of the implants is very important. Here's a situation where the implant was not even put in the bone. It's perforated outside the parameters of the bone, which ultimately, obviously, this implant's got to come out. And so when we look at design, and we'll move on from this, but you have to know where you're headed. You got to know how to deal with a defect in the bone like this, and know that it's there. If you know it's there, then you know how to navigate around it and you address it accordingly. So you don't end up in situations where you've got, all of the threads exposed and the implant becomes infected. But yeah, every case is different. It's a wonderful procedure. We love what we do here. Our goal is just to help patients navigate all of the media and the noise that's out there so that in the end they can make a wise, educated decision on how they have their procedure done. That's
right. And we see that. It's nice to see the questions coming in from like this patient who's probably getting treated somewhere else, but she's doing her research. It's nice when we see patients here coming from other states saying like, yeah, I've been watching the live stream and doing my research and, look other places, and what you guys are talking about is accurate. You guys really are educating. So that's the whole goal with this. And that's pretty much what I wanted to cover today.
Yeah.
So next live stream, what I'd like to do is cover the second news article from that news channel, Arizona. But today, just really wanted to go over the all-on-X. And, if there's more questions that you viewers have about the all-on-X, we're more than happy to not only cover this in the live stream, but we can make videos on the site to upload on YouTube, on Facebook, to where Dr. Willardsen's really diving into the all-on-6 and when that's necessary, or the all-on-X when 8 implants are necessary or 10 implants, and really dive into those specific cases just to educate patients. We know that it's not like a huge audience, but the little audience that we have, we know that they see the value in this.
And we appreciate the small audience that we do have.
Yes, we do.
Because no one cares about any of this stuff until they do.
Until they do need it, huh? Well, awesome, doctor. I think that's all we have for today. We want to thank the viewers that we've had so far and the ones that will, have as this video gets uploaded. And if you have any questions, feel free to ask. You can DM us on social media. You can send us an email at info@trustimplants.com. If you have x-rays or any questions about a procedure that you're getting into, feel free to ask us. Dr. Willardsen's always doing virtual online consultations with patients across the country. And again, don't forget to subscribe, hit that like button, and share it with anyone who is in need of dental implants. Thanks for watching.